The problem is of prostate cancer, and prostate cancer, like most solid tumors, is best treated with surgery as a curative approach. As you know, in recent years, people have been waiting with surgery to see if the disease is aggressive or not. And that's good for some people who avoid unnecessary surgery, but for those that do have an aggressive disease and that the disease does merit surgery, by the time that they go into surgery, then it's a little bit, I won't say too late, but a lot of times the cancer has spread beyond the primary tumor, which means that you'll need to irradiate it later with radiotherapy or all kinds of things. So there's 50% recurrence, there's tons of really bad and nasty side effects and so on. So that's the problem that Exotome licensed technology from Case Western Reserve to combat that. And the technology, it's an agent, it's a theranostic agent, dual purpose agent, and it does both imaging and ablation. So it's systemically delivered. It exquisitely binds to a very well-known receptor that overexpresses in prostate cancer tumors called PSMA. And then it fluoresces in real time. So it's an optical imager, and 90% of surgeries are done with a Da Vinci robot. So the surgeon is looking at a screen anyway, so they see the tumor, it really lights up nicely in red, and the surgeon can cut it. But once they cut it out, there's an initial, we can continue to irradiate the area and ablate any microscopic tumor cells that are in the area that the surgeon missed, that are beyond the cutting edge. And so that's the technology. And so the preclinical work in multiple mouse studies that were conducted at Case Western, this was the only way to get the models cancer-free. So all other modalities, whether you do just the photodynamic therapy or just image-guided surgery or anything, the tumor always came back and expired the models. But with us, for 3 months, 4 months, the mice stayed cancer-free. And so in terms of what other people are doing, so lots of people are targeting PSMA. It's a very well-known, established tumor. A company called, anyway, so you'll see all of that, but we're the only ones that do both. So some people are doing photodynamic therapy, but photodynamic therapy is on things like skin lesions and things like that. I mean, you can't shrink an entire solid tumor just with photodynamic therapy. And so people are doing imaging, and some doing nuclear, which is before the surgery. Some people are doing even optical. We're the only ones that are doing this ablation that comes out after the surgery. In terms of the competitive advantage, so the entire imaging agent space has been hampered by the fact that in the US, it's approved as a drug. And so you have this 10-year timeline to commercialize it, but then it's basically a medical device. And so what we've done is something very different. Exotome is owned by a CRO that has pioneered the method of microdosing for human use. It's an FDA-approved method that takes subtherapeutic doses into the humans as quickly as 1 year after already the preclinical studies have done. So the CRO is very experienced in it. There's multiple FDA actions with their existing clients. And so what we're going to do is we're going to move this to humans probably within a year. We're going to be in the market in probably 4 years. That's the plan. So we're going to be probably 50% of the time and about 60% less cost. So we'll be in the market in humans in 10 years versus in $10 million in 4 years versus 10 years and $30 million. So a company called OnTarget that just got an investment from J&J for $40 million for an imaging agent for prostate cancer. These are the numbers, right? And we can do it in much, much less. So, and this is tracers, and I'll be happy to explore more with you guys on how we do this. But it's been done several times before. There's companies like OncoNano in Houston and other companies in the space that use this technique. Okay, by the way, while we're focused on prostate cancer, this technology is a platform, so the PSMA ligand is very good, and we can attach other types of cargo on it, like chemotherapy, like radiotherapy, and so on. So there's upside opportunities to this technology as well. And in terms of an exit strategy, there's multiple types of acquirers, whether on the reagent business, whether on the imaging space, whether the equipment vendors, the camera vendors, the surgical players. So there's 3 or 4 different robot companies now, other than Da Vinci, big guys like Medtronic and J&J that entered the general surgery space. They want to have competitive advantage. So we have multiple acquirers for that. In terms of the financials, I'll just go in terms of the product strategy. So prostatectomy has quite a nice DRG of about $20,000, so that's already good. And at first we'll start with that, but our intent is to go for an ablation code. So the hospital will actually get more money because they can code for the prostatectomy with ablation at the same time. So it won't be any worse for them to do so rather than doing prostatectomies and then ablation in 50% of the time, they can get that code 100% of the time with us. And in terms of funding strategy, with $2 million will be in humans, with $5 million will already be after phase 2 in 3 years, so that's already a monster of a value increase. With $10 million will already be in the market, and with $20 million we can actually get to the market ourselves and sell it ourselves and so on. So we have multiple funding strategies depending on where we can go. In terms of the team, I have multiple years of experience, both in small companies and in business development in large corporations. Go Van Damme is the surgeon that did the first ever image-guided surgery. Jim Bazillion, who is from Case Western, is a luminary in the area of imaging. Has multiple years of experience in that as well. And that's it. This is Exotome.